Whenever I get upset, I take out Dr. Burns' books, either Feeling Great or Feeling Good, and I read them very slowly. I trust Dr. Burns.
Hello, and welcome to the Feeling Good podcast, where you can learn powerful techniques to change the way you feel. I am your host, Dr. Rhonda Borowski, and joining me here in the Murrieta studio is Dr. David Burns. Dr. Burns is a pioneer in the development of cognitive behavioral therapy and the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 30 languages. His latest book, Feeling Great, contains powerful new techniques that make rapid recovery possible for many people struggling. Dr. Burns is currently an emeritus adjunct professor of clinical psychiatry at Stanford University School of Medicine.
Yes, we're going to dive in. Rhonda? Hello.
Hello, David, and hello and welcome to all of the listeners of the Feeling Good podcast. This is episode 401. It's our first episode in the new 400th, 400 to 500. I don't know what I'm trying to say. After we celebrated your 400th.
The greater than 399 podcast.
Yeah, greater than 399, right? And it's an Ask David. And I'm going to first start with a really cool endorsement that someone sent to me that I just loved. And it's going to be a surprise because David hasn't heard it yet because someone wrote to me. So someone wrote, "Hello, Rhonda. I just wanted to share another thank you to you and Dr. Burns. I suffer with very bad anxiety and depression, and I have for about 30 years when I quit drinking. I have been sober since..."
I don't teach you to quit drinking, by the way.
I know. I have been sober, but I've been struggling. I'm also a 9/11 survivor from the first tower on the 56th floor.
Wow.
I guess in truth, I don't think it's been so bad. I also had breast cancer after 9/11, which may or may not have been related. They don't think so, but other than that, I'm okay. I've had some bad childhood experiences, but I know a lot of people have had them. I take a little bit of, I don't know if I'm going to pronounce this right, acetylopram and a little Seroquel to sleep, but I'm basically okay. Whenever I get upset, I take out Dr. Burns' books, either Feeling Great or Feeling Good, and I read them very slowly. I trust Dr. Burns. When I read the book, it's like someone is holding my hand and helping me calm down. I hear Dr. Burns' voice in my head, and it's as if he is holding my hand. It's as if he's calming me down. I'm so blessed just to be here and to have a chance every day. My faith is very important to me. I have a wonderful husband who loves me, and I love him. God has been good to us, and we're grateful. Having depression and anxiety can be hard, but we all have handicaps, I guess, in one way or another. What's great is that I have you guys to help me. Please tell Dr. Burns I'm so grateful. Thank you, Joanne.
Joanne, is that the name? Okay,
Yes.
Thank you so much, Joanne. That's very, very touching. And all of you who write in with such beautiful, touching notes on how our work has in some way changed your life for the better. It means a whole lot, because when we're helping you, we're helping ourselves as well. And that itself is kind of a spiritual concept. So
Exactly.
that's cool. And then one other thing before we dive in, I think we forgot to mention this last week. In August 8 to 11th, I think is the date, 8, 9, 10, 11, will be the summer intensive at the South San Francisco Conference Center. This is a program for mental health professionals. And we haven't had it for 5 years due to the COVID pandemic and other factors, but we're bringing it back. And it's always the most magical and fantastic training. You'll work your ass off. You'll get more than 30 hours of continuing education credit, and you'll be exhausted at the end, but joyous and happy. and you'll get the chance to learn state-of-the-art team techniques so you can begin to get the kind of amazing results that you hear when you listen to the live work podcast. You hear people getting amazing transformations within a single extended therapy session, and we'll show you how to do that. And a second bonus is you'll have a chance to do your own personal work because we all hit bumps in the road and we all struggle with the same kinds of problems that our patients do. And when you do your personal work, you have an extra dimension not only of understanding but credibility and magic
Mm-hmm.
when you reach out to your patients. And there's this simple way that you can find the information about it. And if you move fast, I don't know if we're still in the time zone for the early bird discount. That may or may not have happened. But at any rate, what's that web address? Is it?
It's super simple. It's www.cbtintensive.com.
Oh yeah, cbtintensive.com. cbtintensive.com. And then you'll get all the data and the in-person seating is limited because of the size of the South San Francisco Conference Center. So if you want to come to the in-person version of it, it'll also be online, but the in-person kind of has a little extra special magic associated with it. So we'll have some wonderful luncheons for you, and
Mm-hmm.
it'll just be really special. So hope to see you this summer.
So the cost includes the lunch for the days,
Yeah, yeah. There's two lunches. There's
two
not.
lunches. Mm-hmm.
Uh,
Mm-hmm.
but
Well, we are past the early bird pricing. The early bird pricing ended on June 3rd. Um, but it's completely worth it. And I like that you use the word magic, David. When I first took the intensive, it completely and utterly changed my life. And I did have magical experiences. And it sounds like a lot of hype when I say it. And I'm almost kind of
yeah,
embarrassed to say it, but it's
yeah,
not hype.
no,
It's actually true. All of the opportunities for personal work lead to some pretty magical experiences.
yeah. And if you don't give hype, then you say it's going to be a fairly average experience for 4 long, grueling days. Somehow it
Yeah,
doesn't seem quite so exciting.
I know. That's true.
So, but
Okay.
yeah, hope to see you there. You'll
Yeah.
you'll be doing yourself a big favor to come.
Yeah, exactly. All right, so let's dive in.
Let's dive right in.
So this is an Ask David, and we're going to start with Allison, who asks, I have bipolar disorder and I have had trouble challenging my negative thoughts. I'm suffering. What can I do? Hi, David. Many years ago, I used your book to beat depressive thinking. In the last 3 years, I have been diagnosed with bipolar disorder, and I have found my depressive thinking too difficult to budge, even with your book. I'm really suffering. Any ideas about what I could do? And thank you for your service to humanity. I always recommend your book.
I really appreciate that, Alison. And I've certainly worked with, large numbers of bipolar individuals. That's people who get the high as well as the low. And if it's bipolar one, the highs and lows can be super extreme. When people are in the high phase, psychotherapy, in my experience, is not powerful enough to be helpful. You just need a trusting relationship with your therapist. And I always just added some pretty heavily sedative drugs for a few days so they wouldn't have to be hospitalized. And that was nearly always successful. But during the low phase or the in-between phases, I just did what in the day we were calling cognitive therapy, and now we call team therapy as a more potent version. Unfortunately, I can't give you any more information than that because you didn't send me any examples of your negative thoughts. And this is one thing I always emphasize is if you have a problem like a relationship problem, send me what did the other person say and what did you say next. Send me something example, and then we can give you magical information about what's going on with you. And when it's a negative thought, tell me one of your negative thoughts. You see, I've developed more than 100, well over 150 techniques for crushing negative thoughts. And people have at least 50,000 different kinds of negative thoughts. So I couldn't possibly, help you with the negative thought you're stuck on because you didn't tell me what it was. I'd still be eager to hear from you in that regard, and maybe we could mention that in a future Ask David. But to make a long story short, the therapy with people with bipolar disorder who were in the depressed phase was pretty much identical to the team therapy I did with all of my patients. The only thing that was perhaps a bit more common was that people with bipolar often had more all or nothing thinking and more perfectionism and the achievement addiction and thinking they had to be so great and such great achievers to feel happy and fulfilled. And that that urge kind of contributed to their highs and their lows. And learning to develop unconditional self-esteem and self-acceptance was for many of them the key and the cure to the treatment. But in addition, I always felt fondly for all of my patients with bipolar, and I was pretty patient with them, and I always felt that trust was an important part of it. When I did my internship at Highland Hospital in Oakland, I was pretty insecure because I'd been such a terrible medical student, and I didn't know if I'd be competent to treat hospitalized people. But it was a wonderful experience, and as it turned out, and the first person I saw there as a resident was a man who was involuntarily hospitalized, and he was in a gurney on the inpatient unit being fed with intravenous fluids, and he was fulminantly psychotic with bipolar in the most extreme form. And in the old days, the people used to die of the manic phase, die of dehydration during the manic phase. But now, the life can be saved with, given intravenous fluids. But he was totally psychotic and hallucinating, and a plane had crashed in Alaska, and a lot of people were killed, a commercial aircraft, and he had worked on the plane, and he was thinking that somehow he was to blame, or he had designed something on the plane, some electrical system or other. But I remember that we connected with our eyes, and I touched his arm and told him that I would be taking care of him. And the trust was instant, and I just had an instant liking for him. And he recovered pretty quickly from his manic episode, and then I followed him up as an outpatient, and I'll never forget that, and how important I think that warmth and trust was to his the great outcome that he had. And all of my bipolar patients, I felt that way.
Well, that's really a great story. I didn't realize that people with bipolar disorder could die from being dehydrated because they're not getting enough fluid. How is that?
Yeah, I guess they get in such a state of excitement and psychosis. I mean, that's the way he was. He was put in leather restraints and being fed intravenous fluids.
Mhm.
Otherwise, he might have died.
Oh gosh. Well, the bipolar clients that I've had have all been, functioning well enough to be in a private practice. And the thing that I've found the most helpful with team therapy and working with them is, using the daily mood log as a daily mood tracker to track their moods and their thoughts associated with their moods. Um, it's a really great tool for that because you can see as patterns come up how their thoughts and feelings or change by the use of the daily mood log.
Yeah. And I also had to had all of them make a list so they'd know when they're getting manic because it's very seductive. And so you don't want to think about the fact that this might be abnormal because you feel just so high and so excited and you think you're going to save the world. But they all had certain things, like they might start having sex with a lot of people. They might start smoking cigarettes or drinking heavily, things that they don't ordinarily do. They might stop sleeping at night. And so we'd have a little checklist. And when they seemed a little on the high side, we'd go through that. And I'd say, it looks like you're going into a real super manic phase. Let's work together and keep you out of the hospital.
Yeah, that's great.
That's about it. And I'm just sorry I didn't get any of Alison's stubborn negative thoughts, because that's my top favorite topic in the world, is how to get a breakthrough. I will give a hint though, when you can't talk back to a negative thought, 95% of the time it's an agenda setting issue. There's a part of you that doesn't want to let go of that thought.
Well, maybe Alison will write us back with some more negative thoughts that we can be more, that she could be more specific, that we could work on in a different Ask David episode.
Yeah, because the meaningful answer to questions is always specific. This abstract generalization stuff, as the Buddha so often said, sucks.
Yeah, that Buddha.
Yeah.
Our next question, we're withholding the person's name.
No, that's his name withheld.
Oh, that's his name. All right.
Yeah, Mr. Name withheld.
Well, it could be Miss Name Reheld or Mrs. or Ms. Name withheld.
Yeah, or both.
Or both. Yeah. Okay, so can or should a person really and truly accept their dark side? So, hello, David. My name is Name Withheld, and I'm working on my PhD degree in neuroimmunology, but I'm in location withheld. I had come across your book, Feeling Good.
By the way, a lot of the people whose name is Name Withheld are located in the town called Location Withheld.
It must be such a big place to live.
Yeah.
So I came across your book, Feeling Good, and your podcasts by one of my therapists. They had an immense impact on my way of thinking. I really love disarming and using I feel statements to connect. I had also realized that by finding some genuine truth in a person's belief, even if it sounds ridiculous, I would automatically develop a certain level of respect for that person, and I really love that. I feel really happy that I can respect a person even without accepting his or her beliefs. I'm now working on my distortions. I really love working on my mind that way. Anyway, I wanted to ask you a question. I wanted to ask you if a person can accept his or her dark side. I seem to have loathed myself for quite a long time and couldn't stand living alone without a partner or person around. I hated myself for disrespecting my mother whilst growing up. But sometime during December of last year, I had an epiphany of why things happened the way they did. And somehow I learned that the reason why I disrespected my mother was because my father, after their separation, kept filling my mind about how wrong my mother was for breaking up the family. And I believed him because I had a good rapport with him, better than I had with my mother. Also, my mother was very awkward in building a relationship with me, and I had misconstrued that with her indifference toward me. After that, I stopped hurting myself over it because I had learned to empathize with myself then. I sobbed profusely that day. Is it really possible to truly accept yourself? I feel at ease a lot more these days than I used to before, but I also have to battle my distortions too on a regular basis. So please help me out here. Thank you so much for everything that you've done. I really love your work.
Okay, well,
that's a bunch. That's 2 or 3 topics right there.
Oh, yeah. Well, that's a beautiful, beautiful note. You want to take a first stab at it?
Well, there's so much he talked about. He talked about accepting the dark side of a person. He talked about helping people in poverty. Is it him who talked about helping people in poverty? No, that's the next one. Okay. Accepting your dark side, accepting, can you truly accept yourself? And, oh, darn it. I left my notes at home, but, so many therapists who are founders in our field, like Freud and Jung and you have talked about the dark side, that there's that we accept that we have a good side to us and we have this dark side to us. And I'm wondering, the dark side comes like when we're angry or when we're jealous or when we're having the feelings that are that are ones that we may not want to experience. And then the dark side comes up and we might find ourselves doing things that, you know, we we don't that might not meet our, our core values. Like for example, for me, I this is like very simple, but when I'm really, really hungry, I am totally in a dark side and I get angry easily and I'm snappy and I don't even realize, oh, I'm in a bad mood because I'm hungry. I just feel like a dragon could come out at any moment. Um, and you've talked about that before. We actually talked about that on another podcast, I think 192 or something. And you talk too a lot about that is acceptance and finding, kindness toward ourselves and acceptance and realizing that we don't have to always be one thing. Like we're not all good like Mother Teresa or the Buddha, and we're not all bad like the devil, but all of those pieces are woven within us. And if we just accept ourselves as a whole person, then it might be a little easier to accept that we have, this kind, compassionate side and also this dark side. I don't know.
Yeah,
What do you think?
yeah. I totally agree. And I think Carl Jung's point was not that we have a dark side, but the sin is not accepting it,
Uh-huh. Yep.
insisting on this innocence and then looking down on other people, and denying our own uh, hostile or malignant motives. And I think that's where a lot of the real problems come in is when you try to deny it.
Mm,
Um, and a lot of wars are like that. People like Putin now is waging the most cruel war on the Ukrainian people, and many Ukrainians are being murdered. Some are being tortured, but he presents it to himself like this is some positive thing for the destiny of Russia and based on historical precedent. So he by denying his dark side, it attains full malevolence. And then on a simpler level, um, I was having a dialogue with a colleague, and after that, I got an email from her, and she said that something I had said had hurt her feelings,
mm,
and so she wanted me to know about that. And ordinarily my first response would be that she had misunderstood what I had said, that type of thing.
hmm
That we maintain this facade of innocence. But later, when I thought about it, I realized that I had, in a sense, put her down with a comment and asked myself why. And then I recognized that I had some uneasy feelings toward her. And I said, boy, I better think about that. And then I began to think about it and realized why that was. And that's something I need to talk over with her to own up to the fact that maybe I am feeling a little angry with her. And here's why. And that could actually lead to a deepening of our relationship. But if I have to accept the fact that I was kind of insensitive and subconsciously put her down.
Oh, I was just talking to you when after we did some, listening to everything everyone said on episode 400 and listening to the beautiful work that you did with Cody, you and Jill. It's my experience of you is that you're such a warm, loving person. It's kind of hard to imagine that you also have a dark side.
Yeah, well, and also the culture shapes us into that because people see me as a leader and they want to see me as something bigger than life, and that's how cults get going, and uh, and a lot of leaders are like that, so they feed off that, and so I try to be somewhat careful about the image that I project. And that's one of the reasons I like writing books so much, because I actually have a carefully crafted positive voice of myself in my books, which is actually yeah, nicer and warmer than I am in person. Although as I've gotten older, the way I talk and communicate with people has gotten softer and gentler and warmer, and I'm grateful for that. But but yes, I have a strong dark side. I can get really angry and pissed off sometimes, and more. And that's just the absolute truth. And as I've gotten older, I just kind of have lowered my standards, and I just try to accept myself, especially when I'm screwing up, because then it's easier to own up to it than
Hmm.
if you're trying to hide it from yourself and thinking some people are good and some people are evil. And I think all of
Hmm.
us are a mixture of good and bad, and that's not the biggest sin. The biggest sin is denying your dark side and trying to convince yourself and other people that you're some kind of perfect person. But
Right. It's not
but
not
you're
just convince
not.
yourself, but convince other people.
Yeah,
And
yeah.
you
Convince
work hard not
yourself
to,
and other people.
yeah. And from, I'm listening to you talking, it sounds you work really hard not to be put on a pedestal and be seen for other than who you really are.
Yeah,
Yeah, I
yeah.
appreciate that.
But it is seductive, because when people put me on the pedestal, it appeals to my narcissism, and I
Hmm.
guess, oh, that's pretty cool.
Hmm.
Maybe I'm the new Jesus or something. Yeah.
Yeah.
Uh,
It's hard though. It's a lot of pressure. This is kind of off the subject, but at the last intensive that you did in 2019, I was the new on the podcast, and you introduced me to the intensive with people. Oh, this is the new podcast host, and I think I'd done a couple, and people kept coming up to me saying, "Oh, you're so great, you're so great." And I was like, "No, I'm not."
yeah,
And then
right.
people
Yeah.
kept asking me questions like, "Can I ask you a question about this subject?" And I can ask you a question about that subject,
Oh, yeah.
and I was like, I remember this.
It's amazing, isn't it? How that
Yeah,
happens.
yeah.
Uh,
It's quite
I'll
awkward,
show you
actually.
one a better way to answer that.
Instead of saying, no, you can't ask me that, but you can ask my friend Heather, who's standing right here.
Well,
She'll answer.
yeah, yeah. When they say you're so great,
What?
well, yeah, we'll role play it.
Oh, David, you're so great.
I know, I know.
I know what do you say? It sounds phony to go, oh, no, I'm not. And it sounds weird to
Yeah.
go, oh, yes, I am. So just say, thank you. Oh, really? Thank you. Thanks. I really
But
appreciate your kind words.
you can do it nicely. Say, I really appreciate your admiration, and it means a lot. I
Yeah.
I I work hard at what I do, and when people appreciate the work, it means a lot to me.
Yes, that is true. That's true no matter what the work is, whether it's
Yeah,
us doing the podcast or a teacher or somebody's therapist or a,
yeah,
firefighter or,
yeah.
somebody painted my bedroom. I really, really appreciated him. Whatever the work is done, when it's done with great quality, it's really appreciable.
Oh, yeah. We always express so much gratitude to the people who come to our house and work on the house. And when we're at a restaurant and there's someone there serving us, we try to give a generous tip, and to
Hmm.
tell them how much we appreciate what they're doing.
Yeah, I don't think people do that enough.
No, I don't think so either, because when we do that in a restaurant, they quickly remember who we were,
Hmm.
and they're so grateful to see us when we come back again. And you can just see the joy that they have. Oh, here's one of the customers who treats us well.
Yeah.
It's sad the way, especially here in the Bay Area, but really worldwide. So many people have so little money, and my wife and I had very little money. Melanie told me that, when we were in internship and residency at Highland Hospital, we had income. We'd been homeless before then, so we felt rich. But she said still, most of the time, it'd be a week before the end of the month, and the paycheck, and we'd only have like $2.30, for the food for the rest of the week and stuff like that.
Oh.
How do we get into this?
How do we get into that? Well, we can just segue into Trainor's question because this one is about poverty.
Yeah, okay, yeah. And you're right. The trainer question is a multimodal question.
hmm So he asks, in team therapy, there's a strong emphasis on changing the way you think. But is it sometimes also important to change your behavior to make real changes in your life or to help others who need help changing their circumstances? For example, people who are struggling in poverty. Hi, David. I've asked several questions over the years. I asked about artificial intelligence, which I much enjoyed the episode on that. So feel free to ignore this email if you think I've overburdened you guys. Anyway, I had a question about changing thoughts versus circumstances. You often say that our thoughts create all of our emotional and interpersonal realities. I thought maybe a better or more nuanced definition would be to also mention that events can change our feelings, but they do so through changing our thoughts. I've heard Matt May mention this idea in some circumstances as the low road to recovery, where you actually get the thing you think you need, and as a result, you feel better. However, I thought about certain situations where changing the circumstance could also be a valid solution to an individual's problems. Take someone living in poverty, for example. I'm certain that cognitive behavioral therapy could help this person change their emotions around their experience of living in poverty. But would bringing the individual out of poverty be considered a low road to recovery? Or could we say that bringing someone out of poverty is also a valid way of changing their emotional distress? Like sort of how therapists use both exposure and cognitive techniques to quell phobias or certain anxieties. I personally like this definition because it includes the ability to change your circumstances as a method to change your thinking, without it being the only method. It also makes sense in a world where people want to make changes in society, giving women the right to vote, ending child labor, and create environments that foster positive thinking. I think so much focus on the cognition, while fundamentally true, makes it feel like people should focus exclusively on changing the way they think about a situation, when in reality, it seems like we can both change our circumstances and thinking simultaneously to make our lives better. Anyway, I just wanted to know what you thought about this idea. Thanks for everything you do, Trainor Peters. P.S. I have nearly completed my first year of my psychology undergrad to become a therapist, a counselor, in great part to you and all of the wonderful people on your podcast. So thank you so much.
Thanks for that great question, Trainer. Let me say in the first place that the original name was cognitive therapy in the early 1970s, and then it quickly became changed to cognitive behavioral therapy because there's an equal emphasis on changing behaviors.
Mm,
And so you're quite right that behavior can be important, just as cognitions can be incredibly important. Especially when people have relationship problems, they often have to change the way they communicate with other people. And this is actually much more difficult than changing thoughts. The resistance that people have to giving up hostile, abusive interactions that they're having with others is very, very intense. And learning the disarming technique and thought and feeling empathy and stroking and the five secrets of effective communication. People fight very heavily not to have to do that because they would rather live in a state of hostility and arguing and defensiveness. But also, sometimes let's say that you've snapped at your son or your spouse, and then you're feeling guilty, and you have a lot of distorted thoughts. I'm a worthless father, or, I'm a bad father. I remember a fellow came on the Sunday hike and he was all bent out of shape because he had snapped at his two sons, and he was telling himself, I'm a bad father, and he was severely depressed. And the first step was to work with his cognitions and get him to see that the idea that he was a bad father was, meaningless. It was just cruel, not nonsense. I asked him, do you ever do positive things for your sons? And he says, oh, yes, all the time. We send them to the top private schools, and all of our vacations are going to some places that they would want, and something of educational value and fun at the same time, and on and on and on. And I said, so when you do good things for your sons, does that make you a good father? He said, oh, absolutely. And then when you get irritated and snap at them, does that make you a bad father? He said, oh, absolutely. So I said, so apparently you're a good father and a bad father at the same time? And then he started laughing, and he got his enlightenment. And the idea is not to be beating up on yourself when you screw up, because then you're doubling your trouble, and it doesn't do anybody any good. But then the next step was to say, well, what happened when you snapped at your sons? Let's get real here. Let's focus on the real stuff. And apparently, they weren't doing their part to help out around the house. He and his wife were waiting on them hand and foot, but they were supposed to take out the trash and do certain things to help out, and they weren't. And so he got understandably pissed off and snapped at them. And then his solution was to go back and talk it over with them using the 5 secrets of effective communication, and tell them that he felt hurt, when they didn't do their part, and that their mom felt hurt, and this type of thing. And he said that they all opened up and cried, and the boys felt so much closer to him. So he turned his lemons into lemonade. So yes, you do have to change often your behavior, just as you change the way you think about something. Now, you've had one thing there that I don't agree with. In Philadelphia, my hospital put together a big cognitive therapy, kind of a free cognitive therapy program for the people. We had an inner city gang warfare, drug dealing neighborhood is where our hospital was. And so we developed a fabulous program for our people, and they would have cognitive therapy training for 6-8 hours a day, every single day. And we saw tremendous changes in them. But we were definitely not working to improve the quality of their lives. We were working to improve the quality of their self-esteem and how they were feeling about people. A lot of our people were homeless. Many of them couldn't read or write. And while it's important to have a segment of society that focuses on that's not my calling as a psychiatrist. You can't do everything. But I did do a study on income and self-esteem and happiness. And indeed, we did document, and we've had this on a podcast just recently, that there is a negative correlation between income and how you feel. And people with incomes over 200,000 a year were happier and less unhappy than people with incomes under 25,000 a year. But the percent difference was tiny. And the change that you can get from even a 2-hour team therapy session is profound, like 100 times greater than the mood effect of increasing your income from 20,000 to $200,000 a year, which, if you can even do it, it's going to take a long time. So I think the idea that and there's an awful lot of people who have a lot of money and a lot of prestige who have died by suicide, and it's heartbreaking. And I think it's just an illusion that you need a lot of money to be happy. But I don't mean to minimize, the injustices in society, and the horrible things are going on, and there's not a fair distribution of income, and a lot of people can't afford, even in the United States, medical care or emotional care. That's why I'm creating the Feeling Great app that just hit the stores, the App Store and the Google Store and the Apple Store or whatever it is, and you can get it now. It will help you
Mm.
change the way you feel.
Oh, you can get it now?
Yeah, it just came out this week, and
Wow.
it's uh, a lot of people are getting dramatic changes in less than a day. Working with the little Obi bot named
Hmm.
after my cat
Yeah.
who's my teacher, and
Uh-huh.
also all the classes and lessons I've created for the tool over the past 4 or 5 years. I've been working on it full time. And again, keeping that financial thing in mind, anyone, if it's not expensive, and you can take a free ride and see if you like it in the first place. And then if you do, but can't afford the $99 for a subscription for a full year, just email us and we'll give it to you gladly for free.
Mm. Wow. You're so generous. I don't know anyone else that would do that. That's amazing. When I first read his his email, I started thinking of Abraham Maslow's theories of self-actualization, where you can't, you have to take care of someone's physiological needs like food, water, warmth, shelter has to be taken before they can consider, like the next level and of enlightenment or
Yeah,
self-actualization. And that's like security and safety. So if
yeah.
you're living in poverty or living in homelessness, I mean, you have to have those things taken care of, food, water, shelter, security, safety, before you can, you know, think about changing the way you think or feel. If you're not in a inpatient setting where those needs actually are being taken care of. And even as you move up Maslow's theory of self-actualization, there's nothing in there about income. I mean, you know, the next level is for intimacy, relationships, closeness, social interactions with people. And so, my master's degree is in social work. So when he talks about helping somebody out of poverty, I think that's all part of, helping someone reach a level of self-actualization and entitlement, not entitlement, enlightenment. Um, and I don't know
Well,
what,
that's certainly
mhm.
the goal of team
Yeah,
therapy is enlightenment,
yeah.
really, and to achieve it in a short period of time. I remember reading those so-called third force psychologists
Hmm.
when I was in college, and there were a lot of different people like that with similar messages, and
Hmm.
I also found it very kind of exciting and inspiring at the time.
Yeah. Well, I actually have a client coming up, so I don't think we have time for another question because
All righty. Well, let's see. Um,
unless you
so
think we could do this next one really quickly.
let's see what it the
It it's
Kieran.
Kieran's.
No, that's kind of an entitlement
Yeah,
anger
that's
one.
yeah.
On fairness and unfairness. So we'll
We'll
save
save
that
that.
for our brilliant Matthew May, who will participate in our next Ask David, and the results you can read about them uh, next week,
Okay. Thank
or
you,
you can
David.
hear about them on the podcast next week.
Yeah. Okay. Thank you so much for listening, and thanks, David. I hope you have a great
Yeah,
week.
thanks. Thanks. How did we do, Rhonda?
I thought we did pretty good. Yeah, it
Pretty
was nice to
good.
be. I mean, it's really great when Matt's here, and it was really fun to be just you and me again.
Yeah, absolutely. I thought so too. So thank you everybody, and have a great week.
Yeah.